thing about recording myself. So in your booklet, I had also included, this is warning signs, things that you should call your healthcare provider if you have any of these symptoms. And that, I put it in your little packet. It's called the refrigerator, Pregnancy Warning Signs Refrigerator Poster. So, you know, I don't know if your fridge is like my fridge, but my fridge has like shopping list, pictures, you know, high school graduation invitations from 5 years ago, things that I've never taken down. So this is just a handy checklist, just as a reminder. Also, for in case your husband, you just felt really crappy and he had to be the one that like reviewed everything. If you have any of these warning signs, vaginal bleeding, fever over 100, pain or burning with urination, sudden swelling in your face or hands, problems with your vision or recurring headaches, vomiting or diarrhea lasting 24 hours or more, major change in your baby's movement, sudden pain in your abdomen area. And I also, speaking of the fetal movement, in your packet, I also included a checklist for fetal counts. Your OB, your healthcare provider, will probably talk to you about your fetal kit counts. It's called fetal kit counts. It usually starts at 28 weeks of pregnancy. So you're right in the time frame. To start doing that, you want to set aside some time every day to where you're going to lay down and you're going to track your fetal movements, fetal kicks. And a baby can, usually you want to have 10 movements in about a half hour. Sometimes they take 20 minutes to half hour, but sometimes they can take up to 40 minutes to get those 10 movements. But you want to count and track 10 movements. So on your little sheet, just to give you something to reference, you would say, okay, it is 6 o'clock at night. I'm going to do my fetal kit counts. Write down what time you started, and then you start counting your movements, kicks and movements. And then when you get to 10, you mark how many minutes it took. You know, okay, it was 6 to 20 minutes, baby moved 10 times, or 10 times in 15 minutes. Then you write that down and you do it daily.
Got it.
And always trust your instincts. If you feel like something is wrong, call your health care provider. If you're the one, I feel like any mother I've met, any pregnant woman I've met, your instincts are spot on. Every woman is different. Every pregnancy is different. You're going to know if something just doesn't feel right or feels off. It's always best to call your health care provider. And just trust your instincts. If you just are like, well, you know, it's, baby only moved 10 times in an hour, less than 10, call your provider. Or if you just are like, wow, I walked around, for a couple hours, I haven't really felt the baby move. Definitely call the healthcare provider to see if you can be seen that day. But you don't want to, just trust your instincts and don't ever feel like, oh, I shouldn't call, I shouldn't reach out. Because you're the one that knows your normal routine, your physical changes, you know your body and your baby the best.
So what if, does the baby sleep in there, or?
Oh, for your kit counts? When you're going to sit down and you're like, oh, okay, I'm not feeling too much movement, you can take a couple of drinks of juice, the smoothies I provided, something like that, just to kind of see if there's still, you're not getting 10 kicks, definitely immediately call your healthcare provider. But the reason why you want to kind of track it is if you do it around the same time of day or different times of the day, it becomes a habit and you kind of know, okay, the baby usually is 10 kicks, has never taken more than 40 minutes before. Or in 40 minutes, I've only felt 5. Or I've only felt 2, definitely.
What happens if the baby is not taking? And that does it mean something bad? Or
just call your healthcare provider and say you have not felt the baby move, and you've tried the juice, and that's still no movement. Or you head over to labor and delivery. After 28 weeks, anything that were to come up and you call your healthcare provider, they're going to send you to labor and delivery. So you can call your healthcare provider on the way to labor and delivery, because after 28 weeks of pregnancy, that's where they're going to send you anyway.
Oh, okay.
So preterm labor. So anything that happens before 37 weeks of pregnancy is considered preterm. Mm-hmm. So, generally at 37 weeks you can deliver your baby, but we consider it preterm labor. So these are some warning signs. Change in or increase in vaginal discharge, pelvic or lower abdominal pressure, constant low dull backache, mild belly cramps. This is all stuff that you're, having some preterm labor. Yeah. This is stuff that's expected, but not usually before 37 weeks of pregnancy. Okay. If you feel any water breaks or a trickle or a gush, more than 4 contractions in an hour. Mm-hmm. We're also going to talk about the Braxton Hicks, and I'm sure you've already had Braxton Hicks this pregnancy. Braxton Hicks are contractions, because your uterus is it's a contraction. It's just not a purposeful contraction to where it is consistent. It's something that usually if you sit down, drink some water, it'll pass. Mm-hmm. It's disruptive, but you can talk through it. Yeah. It's kind of like, sometimes you're at the grocery store and you're like, I'm having some Braxton Hicks. Yep. You get in the car and they go away. Mm-hmm. So, did you have a question?
No. Oh. I actually had one of those yesterday.
Yeah. Oh, why didn't it play? We'll watch a little clip.
So I was about 32 weeks along during my pregnancy, and I was getting ready for bed, and...
Can you hear the volume?
I can.
Okay. All of a sudden I felt like a whole bunch of, I couldn't control my water or anything. So I went to the bathroom and realized it was a pinkish fluid, and that it was odd to me that it was a different color, so I asked Ryan to call the doctor and see what to do. And he told us to come in right away that he thinks my water broke.
Well, while she was calling the doctor, I was panicking and trying to get all the clothes and all the stuff together to go to the hospital. And I was a little worried, but I knew that the doctors know what they're doing, and there's a lot of medicines and technology out there to help the baby.
Once they arrived at the hospital, their doctor determined that Krista was in preterm labor. She was given steroids to help the baby's lungs develop quickly. She was also given medication to lessen the contractions that had started. The medication worked, and they were able to keep the baby in the womb for 8 more days.
Through the whole 8 days, the contractions were getting heavier and harder to deal with, and finally they checked me, and I was dilated to the point where I was going to have him on the 8th day.
Their son Leland was born at 33 weeks, weighing 4 pounds and 4 ounces.
The extra week he stayed in, I think it helped quite a bit, because he did gain some weight between when we first were admitted and the time he was delivered, plus with the whole steroids helping his lungs develop. It was kind of nerve-wracking with all the cords and stuff going to him, but the doctor reassured us that it was just for a temporary thing, just to help him, give him an extra boost in his breathing and his oxygen and stuff.
His skin was kind of hairy, and that was normal for preemies. And he was a little bit orange from the jaundice that he had, but he looks pretty normal, but really tiny.
Krista and Ryan came to the hospital every day while their son was in the neonatal intensive care unit to help with his care, feed him, and hold him. Here, Ryan holds Leland skin to skin on his bare chest, a recommended treatment for preemies called kangaroo care. After 2 weeks in the hospital, Leland was breathing properly, gaining weight, and keeping a regular body temperature. Because he was doing so well, he was discharged and taken home.
He's doing great. He's on a little bit of oxygen, but that's just to help him out a little bit. And besides that, he's doing great. He's drinking good and he's gaining weight. Well, I think every pregnant woman should learn the signs and symptoms of preterm labor, and they should kind of understand what it all entails, because I never thought it could happen to me. And I'm glad that I did take that action and called my doctor instead of hesitating and staying.
Reducing preterm labor risk. Go to all your prenatal appointments, prevent infections, including using good dental hygiene, reduce the amount of stress in your life. And I feel like in this class, we're going to practice a couple of breathing techniques, a little bit of relaxation techniques, and it's a good time to start practicing so that you're really rehearsed. And it'll help to do stress. And I know for myself, as being a birth and postpartum doula, I've used the relaxation skills and techniques that I've worked with clients on in my own when I've had medical problems. I passed a kidney stone, and what made me get through was using my coping techniques that I do with clients in labor. And so I can't speak highly enough just personally through childbirth, but it's amazing how those things stay with you and how they've helped me through, when I don't feel well and through other situations. So it's a good practice when because stress happens in, especially like in pregnancy, if you're working, okay, now I'm not going to work, so now we're going from 2 incomes to 1 income and a new baby with diapers, and it's a lot of stress. You have other children, there's a lot of factors that, bring a lot of stress in pregnancy, but it's a good time to practice all your coping skills that you're going to learn here, and your relaxation techniques, breathing exercises in the car when that car cuts you off on the freeway, that kind of all comes in handy. And this is just a fun fetal fact. The placenta and umbilical cord pass oxygen, nutrients, and other substances from your blood to your baby. So be cautious about what you take in. Your baby can't say no to your drink or cigarette. So avoid hazardous substances that can travel to your baby. So I have my umbilical cord and my baby. So you can kind of see. You asked me about the placenta. Let's see. Put it in my little sack here. And then this is a nice demonstration because it shows you the vessel and the arteries that go. So you can actually kind of see, oh, my little baby disappeared. Yeah, and then these are the vessels.
And this is all like my blood going to the baby.
To the baby, and then back, and then the deoxygenated blood goes back to the placenta. And this. So this is what you're feeding the baby, and then what is used up and done, the waste goes back to the placenta. And then this is the placenta. So when you were saying, they said you were, your placenta was high, and that's probably
right there.
Right there. So see if the baby, let me turn my baby upside down.
So then I would be feeling my kicks where?
So the baby would have to go through, see, feel how thick this is. So that's where you're just feeling the placenta. But you're probably feeling the kicks in your bladder, on your back,
I feel them like down
here, And that's what they mean
Okay.
about like that you don't feel it so much here.
Mhm.
I don't know with your first pregnancy. I know with my second pregnancy, my placenta was more in the front than my first, so I didn't see a lot of the elbow movements
Yeah.
and the weird alien movements.
Uh-huh.
But yeah,
Okay.
and I got my little baby and the amniotic sac, which is blue.
Mhm.
And this is my uterus. And I love my little baby. I just haven't named it yet.
So
But
when they cut the umbilical cord, does it hurt them or no?
No, it does not. So it does not. And we're going to actually talk about that. There's this new recommendation where this is so nutrient, has so many nutrients for the baby right before the baby has to like start on its own, that there's been studies shown that it's a good idea to delay cord clamping, and a lot of hospitals are doing that now. They're waiting up to 5 minutes before clamping the cord, so the baby gets the last of this really highly nutrient
So-
cord blood.
Before, when they take out the baby, they keep the placenta as big? Or
No, you're going to deliver the placenta, and we'll talk about that. So the placenta, have you heard, and this is something we'll definitely discuss if you'd like, some people like to take this home and have it, freeze it. You can eat it, you can have it put into capsules. There's doulas that will dry it out for you and put it in capsules. It's really nutritious. You just have to put in a request in your birth plan if you want to keep your
Okay.
placenta.
And do they charge you for that, or you don't know?
No, hospitals don't. You just have to sign paperwork that you're going to transport the product, like on ice, and it has to go directly home.
Okay.
But although I don't know about your delivery in hospital because I've never outlined there before.
So they can call and ask.
Yeah,
Or
you can
whenever
call
you
and
go.
ask them ahead of time, and also put it in your birth plan. Say I'd like to keep my placenta,
Okay.
and they'll let you know.
Okay.
I've had some clients who didn't want to eat it, but they felt like they wanted to bury it in their garden, have a little ceremony, and they've done that.
Okay.
Yeah.
I wonder how they put it into capsules. Do you say it's
It's like gets dehydrated, like dried up, and then they grind it, and then they put it in the little gel capsules so that you can swallow it. And I can get you some more information on that.
Yeah.
If you're interested in that.
I didn't really know. I've seen it a lot. I've seen videos on it, but I didn't know if like people had to pay for it, like to.
Yes. I've never been trained in that, but I know here in the area where you live, I know there's got to be a doula that does that.
Okay.
And we'll talk about that, and maybe we'll reach out and do some researches. I'll do some homework for you because I'd be interested to know. Because Chapel Day, since we have both locations, we have some patients who live here in Grass Valley and some patients who live in Auburn, and just so I can put it on my resource list.
Okay.
So now we're going to talk about Kegels and how important Kegels are. I also put a handout in your book about how important Kegels are. So, as women, we know Kegels are really, really important, but we don't do them enough. But I just want to say that they, for in pregnancy, it decreases the risks of developing hemorrhoids and leaking urine in the last trimester of pregnancy. It's very common that you'll be at the store, sneeze, or even, stand up too fast, from squatting, and you'll leak a little bit of urine. Really helpful to do your Kegels. And it prepares the pelvic floor for childbirth, improves healing of the perineum from episiotomy, helps to prevent urinary incontinence as you get older. And this is something that all women, even women who haven't had children, the older you get, your pelvic floor muscles, everything just gets weaker and looser, and you could be doing an exercise class and wet yourself. So they're really, really important, something that it's hard to remember to do.
Yeah.
So if your breathing techniques. If you're having some road rage in the car and you don't feel like doing breathing techniques, do your Kegels. You know, you just want to do a quick, hold for 30 seconds if possible, or build up to that, but just whenever you can. It's really important, especially after your, as you get older and you've had a couple of vaginal deliveries, your pelvic floor muscles do become weaker and they really need to be exercised.
Yeah.
And so it'll also help you in recovery time after labor. So we'll show you a slideshow of the female organs. So yes, the pelvic floor muscles, especially after having a baby.
Yeah.
Shortened, easier pushing and birth. More control during crowning, less tearing. So the stronger, if you start doing your Kegels now and you start getting them really strong and become like a daily, something that's just part of your daily like exercise. Same thing with doing the elephant, my little lazy elephant over the table. Then you're going to be able to, I don't know if you remember with this with your first child, but when you're getting ready to push, sometimes they want you to have a more controlled push when you're pushing the baby out so that you don't tear. And they'll tell you, wait, stop, don't push.
Yeah.
And so if you have really strong pelvic floor muscles, you're going to be able to control your pushing and it won't be uncomfortable.
Okay.
And so that is why you want to have really, really strong pelvic floor muscles and work on your Kegels. And they're great postpartum. They, enhance sex for women, and men can also do Kegels.
Okay.
And who knew?
I didn't know that.
I know. Who knew? But if you mention that it improves intercourse, men will be like, did you do your Kegels today? Partners will be, don't forget to do your Kegels. Remember, childbirth educator Cynthia said it's really important to do your Kegels for childbirth.
Oh, wait.
So yes, they will be like, don't forget your Kegels. So, and the urinary incontinence, it really helps with that. Me having the opportunity to also work in gynecology in offices that do gyno stuff, definitely seeing older women with poor pelvic floor muscles and how important that is. And it's just, and I think this generation, I think now women are starting to learn and feel more comfortable talking about Kegels, sex, and your female parts, but a lot of older generation women, I've noticed that just like they never talked about down there, so they never did Kegels,
So now they're wearing
and now they have incontinence problems. They have to have like their bladder lifted up, they have to have slings, they have to have donuts, and it's just, and I feel like it's just the more comfortable you get with talking about it and doing it, the better it is.
Actually, my 6th grade teacher taught me those.
Oh, really?
She would have us do those in class.
Oh, nice.
Yeah.
And so
She
to
would
also
eat it.
stop and when you're peeing, sometimes that's a good way to also get used to it. Yeah.
So for the ripping part, if you don't need, so if a doctor sees you need to be ripped, do they just automatically rip you? Or?
Oh, the episiotomy?
Yeah.
They would do a surgical incision
Oh, that's what it is.
to cut you, yes. So there's a couple of, there's two sides to that. If you tear naturally, it might not be as bad, or you might not tear, so there's always that risk that it'll be a small tear. If you get the episiotomy, you have to heal from that. That's stitches. And what if you didn't need the episiotomy? So there's as a doula and having worked with doctors, it's the big catch-22 right there of which is better.
Because I did
if-
have that
With your first
one.
they did an episiotomy?
Yeah, and I didn't even know what it was.
Oh, okay.
So I was like, what?
And how did you heal from it?
It burned really bad, and then I think they gave me like this cold spray.
Yes, to numb it, and you have to keep it really clean after you pee. You can't wipe.
Yeah.
So
But I didn't know if I had to because they didn't tell me if it was because the baby was too big or because I
some physicians.
just thought they just did it right away.
So some physicians do it automatically and won't even ask you because they won't ask you because chances are you'll say no. You'll say, "Can I try to do it without?" They just want a clean cut they just want to like be able to repair it, clean it, and prevent it. Everything in medical, their approach is always prevention, and intervention of like she might tear. So I've worked with some doctors who will ask, and I've worked with some doctors who won't ask. And I've, as a doula, been in a delivery, and they just don't, they just do it.
Okay.
And that's why I feel like childbirth education is really important and empowering you to be able to say, hey, wait.
If I don't need it.
If you don't need it, or to know. Informed consent. I feel like informed consent is really important for you to know, like, why are you doing this? What is the risk if I choose not to? And do I have a second to think about it?
Yeah.
Obviously, during pushing, you do have kind of a second.
Kinda.
You could. If it makes you feel better to say
Would
yes.
it be better if you don't get a birth coat? Would it be harder if you turn naturally?
Well, that's the thing. So I'm glad you're asking this because it's good practice for me, from my personal belief, from what studies have shown. My personal belief is that. Well, actually, I don't even think I want to side you with that. So the thing is I've seen tears that were really painful and really hard to heal from.
Okay.
I think that your biggest thing is preventing the tear by doing your Kegels. There is, you can massage you can start putting olive oil, you can start massaging that area. I know this far in pregnancy you can't really reach, but some partners do, massage the area. I know, I've seen doctors who will get the oil and they'll massage the area and they'll be like, we're going to just try to prevent the tear. And so just talk to your provider about that. And when we get to the birth plan and talking about your birth plan and deciding what you want to put in there, it's always just a good idea to have these what-if scenarios.
Yeah.
So at least if you say, I would prefer not to have an episiotomy, or ask my permission or let me know before it happens, they will try. And then they'll say, okay, the oil didn't work, the stretching, a doctor wants you to have just a smooth delivery too. Yeah. So if that doesn't work, then they'll tell you ahead of time. But at least you can ask them to try with the oil.
Okay.
Lap break. Your bladder's baby first squeeze toy. Pretty much. And since we're at a lap break, do you need the restroom or anything?
Nope.
You're good? Okay. So do you have any further questions? Let's see if I can turn the volume. These are just cute little clips. Anything... Of course, I'm like, where's the pause button? Well, you're ready to move on to understanding labor? Do you want a snack or anything? Are you sure you don't want to take a break? I've had you sitting here for an hour and a half already. Okay. Understanding labor. Here's the fun part. This is my favorite part.
Yeah.
And so, like I said, we have the book here if you want to. I'll tell you right here. It is 11. And this is where we can play with our pelvis a little bit more. Was that the pause button? Oh, think about experience you've had with pain. And what ways do you imagine that labor pain will be different for you or your partner? So you're already ahead of the class because you've had a birth before. So you've had experience with pain. So how did you cope with the pain of childbirth?
Well, this one might be different, so I might be more relaxed. Because the first one, I had my mother-in-law in there. I wasn't so, it was my first child, very, like, conservative down there. And, my husband was, like, really excited, so he was, like, making jokes, When I was in pain, it wasn't so good. But this time, I think he's more, like, relaxed, and he knows
what to expect,
what I do like and what I don't like of labor. And it's just going to be me and him. So he helps me with breathing sometimes. Sometimes he gives me massages. So I don't know if it's going to help, I don't know if it'll be the same pain.
But at least you know that your contractions, that, it's the one time in life that you welcome the pain, I feel like. It's a one time in life where you're like, I'm in pain, but this is a good thing. Because it means, like, the baby's coming, and it's like, it's not like the kind of pain where you wake up and you're like, I need to go to the emergency room. I don't know why my back is hurting. I don't know why. I mean, this is the one time that we know we welcome the pain.
Yeah, so I've never been in pain. I've never broken a hand, never broken anything. So it's like, ow. I'm such a baby.
So, this is the acronym that we use to describe pain. It is purposeful, anticipated, intermittent, and normal. So we know it has a purpose. We know why we're going through that pain. It's anticipated, like we know it's coming. We know that we have that one contraction is going to lead into the next contraction. So it's anticipated. We know it's coming. And it's intermittent, which means you do have that little bit of a break in between. The thing that first-time moms are always feared is that when they feel that first contraction, that they think, that's it. Like, you're not going to be able to take a breath. You're not going to be able to pause from this. The wonderful things about contractions is it does give you that moment of regrouping and of rest. It's a short amount of time, but it does give you a little bit of time to get ready for the next one. And they don't, they have the mountain climb. You go up the mountain and then down the mountain. So at least you know when you hit your peak that you're going to come down. As you're going up the mountain, hit your peak and then come down. So that's always a good reference because okay, once you've hit your point and then you just got to come down. And it's important that that you do have a supportive partner who's going to know what he can do to help you with relaxation, because when you're the one that's in it, you can't ask. You can't talk, you don't know what to ask for, and so it's important that your team, your husband, knows, okay, this is what she likes, or this is what, she doesn't like, or just to be able to read your face. You can be in a position or have your back rubbed over a birth ball and it helped you through a half hour of contractions, and then all of a sudden it just stops working and it's time for him to move you to a different position or try something else. Try a different technique of rubbing your back, your feet, or just to really watch your face. And this is the fear tension cycle. So when we become really fearful, our first reaction is to tense up. And I do this too. And I'm always like, I know better, but something really scary happens and your first reaction is right away to tense up and hold your, and what is that doing? You're tensing your muscles. So you're not relaxing your muscles. And it's so important that we want our muscles to relax, let your uterus do what it needs to do. So it's kind of like that you're not, almost like your body wants to like stop contracting because it's like you're so scared and it's like a fight or flight. That's what they call the fight or flight, you know, like, oh my gosh, I'm not going to move, not going to breathe, not going to do anything. And it could actually, that fear and tension can really slow down your labor, slow the progression, and could really stop labor. And sometimes there has been instances where somebody might have trauma around childbirth, might have trauma, childhood trauma of sexual abuse, and so every time that even the idea of the doctor having to check down there, they tense up, they get scared, they tense up, and they can actually stop the labor from progressing at all.
Yeah.
Your body will just be like fight or flight, and then will shut down, and we're not going to have this baby. And this we'll talk a little bit. The gate control theory. Pleasure and other sensations reach the brain first and block pain sensations. And this is when, and also in your handout, I had given you about how important the hormones are to your body. Amazing hormones. Oxytocin, the love hormone, calm and connection. Endorphins, pain-relieving hormones, prolactin, mothering hormone, and of course, I can't pronounce this. Your catecholamines, which stress hormones, fight or flight. That's the hormones we don't want. Which I guess it's a good thing that I have trouble getting tongue-tied with that hormone because we don't want that hormone.
Yeah.
You want the oxytocin hormone, and the oxytocin hormone is an amazing hormone. It is what makes me a birth junkie. It is what happens to, I'm not the laboring woman, I'm the labor support, but it's what my own body releases after witnessing a childbirth. That is what I'm a birth junkie for. That is, I love the feeling of oxytocin myself, because that's what happens when I'm at a birth. So, this is the gate theory, and this is what it's talking about. It's talking about how the more pleasure hormones and the better we're feeling, you can actually block your brain from receiving the pain hormones. So anything that you really want the pleasure sensation, the rubbing of your back, I love having my feet rubbed. So for me, that's like if somebody rubs my feet, I love that.
Yeah.
You know, anything like that you love that you talk to your partner about is going to help block the pain getting to your brain.
Okay.
And it will it's your body's natural way of pain relief.
That's good to know.
And the 4 P's of labor. Passageway, passenger, there's our passenger, our passageway, get to use my props here, and the powers, and the psyche. Staying relaxed during labor can help your psyche, the psyche. Passageway. Your pelvis is part of the passageway, which I've already showed you your pelvis. So this is the view. I'll come closer to you. And then we have our passenger. So this is going to talk about pelvic station. So when your doctor's going to start to check you around, I have to do my, so at 34 weeks, you go every 2 weeks. So at 36 weeks of pregnancy is when they start doing pelvic exams and they start checking your cervix. Any earlier than that, they just don't want to take the risk of infection or messing with your cervix at all. But around that time, that's when they're going to. So, this is the part, I don't know if you remember, because you had your second at 39 weeks pregnancy. So, this is when they're going to talk about pelvic station, where the baby's head is in. So I'm trying to figure out how I'm going to show you this to match the picture. I'll do it this way. My poor little baby. So this is the pelvic station. When they feel up there in your cervix and they're doing a pelvic exam, this is what you hear them say. Oh, she's minus 4 centimeters. Or she's +1, +2. This is the stations that they're talking about. This is what they can feel where the baby's head is resting in your pelvis. And when you're in labor at the hospital, that's what they say. She's a +1 or she's a -2. This is talking about the position of the baby's head in your pelvis. I'll just hold on to my baby in my pelvis.
Could the baby already be there? Like now? Not yet.
During lightning, the lightning period, which happens, which is the descent into the pelvis, that's the lightning feeling that you'll start to feel. You'll start to feel more pressure.
How many weeks is that?
Or how many weeks? About. You can start having some lightning around 36 weeks. 36 weeks of pregnancy.
Yeah.
This is your second. Every pregnancy is different. So for some patients, they don't deliver. They deliver always at 38 weeks of pregnancy. Because the estimated due date is just an estimated due date. So they'll start feeling the descent of the baby into the pelvis sooner. But that's when you start feeling the relief up here.
Yeah. Okay.
Where
That's when you say the baby drops.
Breathe. Yeah, that's what they mean by the baby drops. It's easier to say the baby dropped versus, even though we know it's not that quick, that the baby dropped versus it starts to descend into the pelvic, into the pelvis. And your baby, the passenger, and this one has a video, so we'll play that. Can figure out how to use my little thing. This is a great animation, and I'll also do it along with you to see. There's no audio. Okay, let me get in my position. And it's like a quarter turn. Baby's head comes out. And then remember, the baby has to turn again to make room for the shoulders. Or did you say ow? And this is a great demonstration of just to be able to talk about when somebody says that they have back labor. It's when, so here's the baby's skull, the skull plates, the occiput bone back here. So when somebody's having back labor, it's when instead of coming, this is the ideal position that we want to have the baby descend from. But sometimes the baby decides, no, face forward. I'm going to come face forward. And that is putting the thickest, biggest part, hardest, difficult part of the head on your back. So that's when you hear about people saying that they have a lot of back labor. And the back labor, and we'll practice the stretches and positions that will help relieve that. The most important thing is to not be on your back. You really want to do anything over the ball, any kind of squatting, anything to kind of get the pressure off your back. But that's what happens when you hear women say, oh my gosh, I had the worst back labor.
Oh, okay.
It's based on where the baby's head.
Okay.
And that also is a little bit hard to
Pushes down.
deliver
Okay.
because it's such a tight.
And that's your tailbone, right?
Yes.
Oh, it's not. Okay.
That's your.
Got it.
Yeah. And that is a little bit harder and tighter for them to get through because this
Has to,
doesn't flex as well, right? We know that's really painful. That's a hard little knot. Tailbone to come through. Yeah, so a lot of work goes into that.
Okay.
Yeah. And then, baby. So that was a nice little visual of, oh yeah, the anterior and the posterior. This is what I was talking about. Posterior, with the baby's head back here,
Okay.
facing out. That's where you're going to experience a lot of that back labor, a lot of pressure in your back, where it just, where you almost feel like your contractions, it's just, you're like, I don't feel anything up here. It's all on my back. It's all on my back. And that's when the labor positions of leaning over a ball, leaning over the bed, and we're going to practice some of those, really help relieve the pressure in your back.
Okay.
I don't know if you've seen birth videos where women have given birth on all fours.
Mm-hmm.
It's because that's the most comfortable position because then the baby, you're dropping all the weight off your back.
Your belly.
Yeah. But the anterior is usually the most common, but although there's a lot of back labor too. So as your birth coach, your partner, if you're having a lot of back labor, he's your birth coach. He's the coach is the one that's going to say, let's change positions. Let's change game plans. Let's, let's huddle and change game plans.
And do they provide a ball there, or should I take my own?
They do have
As
balls
active
there.
labor progresses, the baby starts a process called internal rotation,
I'm going to see
which
if I can
positions
get
her head for birth. Usually, the baby's head turns so she is facing her mother's back. This is called the anterior position and allows her to more easily fit through the pelvis and into the birth canal. In some births, the baby's head turns so that she's facing her mother's front. This is the posterior position. In this position, her head puts added pressure on her mother's back, which may cause back pain and slow down the labor.
You want anything?
With her mother's support, Nakaya has been in labor for 8 hours. She tries certain labor positions, like leaning forward on her hands and knees, to turn her baby to the anterior position. This also helps relieve some of the pressure against her back.
There was a point in my labor where I was on the exercise ball and I was doing a different position, like laying on the bed, to help me take my focus off of the pain and onto other things.
And now we're to the powers. The powers that be. Our superpowers.
Yeah.
What I think they're superpowers. So the powers are everything in the uterus and the muscles in the wall. It's all working, all the muscles in your uterus to push and contract and move the baby down. So to me, women, we're powerful, we're Wonder Woman, but you really, your uterus knows what to do. Your muscles know what to do, and you really rely on the powers of your uterus. And by keeping everything else relaxed, your uterus will do the work and push that baby down further in. Now we're in the effacement and dilation. So in your pelvic exams, I don't know if you remember them saying she's -2 to 50% effaced.
Yeah.
This is what they're talking about, the thinning of your cervix.
Okay.
And I don't have a cervix to show you, but I do have
the measure.
I have the measuring. The base is to thin. That is a closed cervix. That's what it looks like. And I also have my little posters from ICEA that have closer view. Let's see. Of a closed cervix. I didn't know if I could hang posters on the wall here in this room, so I printed everything out on those. So that is when it's starting to stretch and thin and become really, really thin. It almost,
Is that before or after your water breaks?
so this can start happening before your water
Okay.
breaks, before you rupture your waters. This starts happening, your cervix is going to start to thin. It can happen like up to a couple of weeks before you deliver. You start thinning out. And to dilate is like when you're actually opening. But what we want is of course I'm getting tongue-tied of how I should have shown you what a rubber band. You imagine the rubber band, a tight rubber band, and you pull the rubber band as it thins, but it still becomes stretchy. That's what your cervix is doing. It's thinning out, stretching out, but
still closed.
but it's becoming stretchy, like it's still thin, like a balloon. And that's a good demonstration that we'll practice. Let me grab my balloon.